Okay, so let me just introduce the session for today and our speaker. Today is going to be Heart Health Essentials, where Dr. Aashish will be talking about nutrition, exercise, and managing blood pressure. Okay, and what is it that you're going to be getting out of this session today? You'll get a basic understanding of heart function and common condition affecting heart health. You learn about heart-friendly food and meal planning to manage cholesterol. Discover low impact exercises and safe routines to stay active. Practical tips for monitoring and maintaining healthy blood pressure. And you will also be able to understand how small lifestyle changes can significantly improve your heart health. Yeah. And about Get Set Up for all the people who are new here. And for the people who are already here, you all know that we are on a mission to help people, everyone who's over 55, to learn new skills, connect with each other, make friends, and also have new life experiences. Our goal here is to reduce isolation, loneliness, and equip our community, our members, with tools and knowledge to age independently. Our community, we engage in classes online as well as offline, and we also travel together, make loads of friends, and have a lot of fun. Yeah. Now to introduce Dr. Ashish Contractor. He's a consultant at Sir H.N. Reliance Foundation Hospital, and he's also director of the Center for Rehabilitation Medicine and Sports Medicine. He's widely recognized as the pioneer of cardiac rehabilitation and sports cardiology in India. He established the country's first telemetry monitored center in 2001. Dr. Contractor has served as a medical director for major events like the Tata Mumbai Marathon from 2004 to 14, and he's provided sports medicine care for over 100 international athletes. Academically accomplished, he's trained in the US under leading experts, has numerous international publications, and authored the book, The Heart Truth. A passionate sportsman, Dr. Contractor has completed marathons and endurance cycling events, including a 329-kilometer Mumbai-Pune-Mumbai ride to raise 1.1 crore for children with cancer. So that's like accomplishment and more. Thank you, Doctor, for joining us here today. And we look forward to hearing from you. Please do let me know if this is going to be interactive, or would you like to take the questions towards the end?
Thank you, Anita. Yeah, so what we'll do is I will allow me to present for about 20-25 minutes. I'll try and keep it, brief to keep everyone's interest. And it's better to have questions in the end because a lot of questions typically tend to get covered in the conversation. Do the listeners normally put uh, comments in the chat while it's going on? If I ask a question, will they answer in the chat? Do you all do that?
Yes, yes. They will post their questions on the chat as well.
Not questions, even
Comments?
yes, yes.
Definitely. Yeah.
Yeah. So I'm saying if people, so we can be interactive through the chat. That's just
Yeah.
a simpler way of doing it. That
Yeah.
way we can keep the flow going. And if you're not, that's also fine. Okay.
Yeah. Sure. We
So
can start.
super. Yeah.
Yeah, Anurag, you can share the slide.
Yes, please. So today, please go ahead with the slides. We're going to talk about heart health, and I'm going to talk about everything around it, starting literally with how the heart works, what are the problems we have with the heart, how we can prevent it, and what are the steps we can take if we have the issue. So just to show you that, if we look at the heart disease presence sort of worldwide, the red areas are the ones where the highest presence of ischemic heart disease, or in simple language, what we call heart disease is there. And as you can see, unfortunately, India is in the red. India has got one of the highest prevalence of heart disease in the world. And please remember, this is both for men and for women. There is often a misconception कि heart disease आदमी को होता है, ladies को breast cancer होता है. That's not true. Means of course ladies को breast cancer होता है, but the number one leading cause of death for ladies also worldwide and in India is heart disease. So it's very, very important both for men and for women. Next, please. Okay.
अच्छा.
So how does heart disease happen? As you can see, these are arteries which are very clear. The first artery is a very clear artery. Actually, one second. I think you have skipped one slide. Go one slide behind. Yes. This is a picture of the heart. And heart का function है कि आपके body को blood supply देना. That's the simple function. Okay? Or to be able to do this job, to give your body blood supply, it has to pump throughout life from the time one is born till the time they die. Now, to work so hard for the full life, the heart also requires blood supply. Heart is giving all the other parts of the body blood supply, पर खुद को blood supply की जरूरत होती है. और heart का blood supply comes from arteries which we call coronary artery. कॉर्नरी का मतलब हार्ट एंड आर्टरी इज द ब्लड वेसल. तो राइट साइड पे एक है विच वी कॉल राइट कॉर्नरी आर्टरी और लेफ्ट साइड पे दो है. वन इज कॉल्ड लेफ्ट एंटीरियर डिसेंडिंग, शॉर्ट फॉर्म में एलएडी कहते हैं, और साइड से इट्स कॉल्ड लेफ्ट सर्कमफ्लेक्स. ओके, दे आर लाइक द पाइप्स विच सप्लाई वाटर टू योर हाउस, बट इंस्टेड दे आर सप्लाइंग blood to your heart muscle. Next, please. As you can see, the pipe is clear when we are born in the first picture. Over time, because of some damage to the lining, because of cholesterol and other reasons, fat material gets deposited inside the artery. और वो पाइप जो पहले एकदम खुला रहता था, it gets clogged. Next, please. जब ये क्लॉग होता है, you can sometimes get some symptoms. ये नाम शायद आपने सुना होगा. We call it angina. Angina means people will, if you ask people कि angina क्या होता है, they will say angina का मतलब chest pain. ये सही बात है कि angina का chest pain है, but they feel के chest pain left side of the heart. Now, angina does not only need to be on the left side of the heart. The discomfort, I prefer the word discomfort rather than pain. Left side पे हो सकता है या right side पे हो सकता है. Anywhere I say navel, मतलब आपके belly button to your nose, ये पूरा region में कुछ भी discomfort होता है, खास करके चलने पे ज्यादा discomfort होता है, बैठने पे लेट जाने में कम होता है, that can be angina. Now, हर एक टाइम हाथ में दर्द होता है does not mean it's angina, but it's possible. लेफ्ट साइड पे हो सकता है, राइट साइड पे हो सकता है, ऊपर आपके गले तक जा सकता है, पीछे पीठ तक जा सकता है, शोल्डर्स में जा सकता है. All of this can be angina. So, if you get any discomfort, you have to be aware and alert. Next, please. Next important part, कोई भी चीज को हमें प्रिवेंट करना है. ओके, प्लीज पे अटेंशन. कोई भी चीज को हमें, प्लीज डोंट गो नेक्स्ट स्लाइड. कोई भी चीज को हमें प्रिवेंट करना है, वी मस्ट नो व्हाई इट इज कॉज्ड. So the causative factors for heart disease are known as risk factors. Okay, risk factors ये जो कारण होते हैं जिससे आदमी को हार्ट डिजीज डिवेलप होता है. Now I'm going to wait for half a minute and ask you कि कौन कौन से फैक्टर्स होते हैं जिससे हार्ट डिजीज का रिस्क बढ़ता है. लगभग 6-7 फैक्टर्स है. आपको चाहिए, यू कैन पुट आंसर्स इन द चैट बॉक्स. व्हाट आर, डोंट आंसर विथ योर माइक ऑफ, पुट इन द चैट बॉक्स. What are the reasons why people can have heart disease? What are the risk factors? If anybody has any idea, you can put in the chat box. I'm sure all of you know it. Very good. We've already started. किसी ने बोला genetic, somebody said BP, stress, obesity, poor diet, eating habits. Okay, what else? Wrong food, lack of exercise, obesity, cholesterol. Very good. Smoking, very important, very important. Smoking, obesity. One very important, BP is mentioned, very good. One very, very, very important one is not mentioned. Family history, very good. One still very important one is not mentioned. Okay, very good. You mentioned everything except one thing. बहुत मीठी चीज है. That you all have not mentioned. Correct. Now, finally, Sona, Nidhi, and everybody wrote diabetes. Okay, excellent. 10 on 10. So let us go through them one by one quickly. And not only it's important कि आपको पता होना चाहिए कि what it is, but you must know the value. देयर इज नो पॉइंट सेइंग डायबिटीज, डायबिटीज पर व्हाट इज द वैल्यू, बीपी का क्या वैल्यू, हर एक जन को बीपी तो होता है, विदाउट बीपी वी विल डाई, बट व्हेन इज इट हाई, इट्स लाइक सेइंग टेम्परेचर, उसको टेम्परेचर हुआ, टेम्परेचर वी ऑल हैव, but fever is when temperature is over 99 100 like that, correct? So we need to see them one by one. Next. So family history and age are two things which we cannot change. अगर आपके family में anybody's got heart disease, your risk goes up. Does not mean you have to have the problem. It just means that your risk is higher compared to somebody who doesn't have. Okay? Age, as we age, our risk for all these diseases, long-term disease, what we call chronic, right? Heart disease, cancer, stroke, all these diseases ka risk goes up with age. So 50 is more risk than 40, 60 is more risk than 50, and it goes up and up. Ladies, it happens a little bit later because until menopause, they have some protection. India, it is very common to see gents between 40 and 50 having heart disease. वर्ल्ड वाइड इतना कॉमन नहीं है, इंडिया में 40 to 50 इज वेरी कॉमन, लेडीज में इट्स मोर 50 to 60 rather than 40 to 50. Okay, so these two things we cannot change. Next please. So what can we change? Cigarette smoking and tobacco. Many times people don't smoke but they have tobacco, so both these are very dangerous, and this is the single most important factor to change. If you are smoking, please stop. If you're taking tobacco, please stop. Next please. BP. Normal BP is 120, 80 or less. High blood pressure is when it is 140 or 90 or more. इसके बीच में 120 to 140 we call borderline, 80 to 90 we call borderline. So please check your BP regularly. And BP, sugar, cholesterol, ये तीनों साइलेंट किलर है. साइलेंट किलर का मतलब क्या? यू विल नॉट नो इट इफ इट इज देयर. इफ योर बीपी इज हाई, ये गलत फहमी है कि आपको कुछ हेडेक होगा, दैट वे you'll know BP is high. No, nothing may happen. You may feel एकदम fine if your BP is high. Okay, next. कोलेस्ट्रॉल के अलग अलग भाग होते हैं. 4 इंपॉर्टेंट वंस आर टोटल कोलेस्ट्रॉल, ट्राइग्लिसराइड, एलडीएल, एचडीएल. टोटल 200 से कम होना चाहिए, ट्राइग्लिसराइड 150 से कम होना चाहिए, एलडीएल जो हम कहते हैं बैड कोलेस्ट्रॉल, ओके, थिंक के एल मतलब लो या एल मतलब लाउजी, खराब है, वो 100 के नीचे होना चाहिए. और एचडीएल जो अच्छा है, ऐसे सोचो कि एच मींस हेल्दी, वो 40 से ज्यादा होना चाहिए. ओके, नेक्स्ट. Diabetes, fasting sugar should be 70 to 100. 100 to 125 is called borderline. More than 125 को हम डायबिटीज कहते हैं. ये एक रीडिंग में मत कहो कि आदमी डायबिटीज है, क्योंकि शुगर फ्लक्चुएट होता है. 2-3 बार चेक करो अगर हाई है, और हमेशा 125 130 से ज्यादा हो गया मींस देयर इज डायबिटीज. ओके, नेक्स्ट. ओबेसिटी मतलब मोटापन. ओके, ये अलग कैलकुलेशन है जो हम कहते हैं बीएमआई, बॉडी मास इंडेक्स. वो आपका हाइट को भी देखता है, हाइट कितना है, वेट कितना है. दिस इज अ कैलकुलेशन, आई वोंट गो इनटू द डिटेल्स, बट टू पुट इट इन सिंपल लैंग्वेज, अगर हम सिंपल वेस्ट लाइन भी देखें, जेंट्स का वेस्ट लाइन 40 इंच से ज्यादा होगा और लेडीज का 35 इंच से ज्यादा होगा, वो उसको हम ओबेसिटी कहते हैं. पहला कहते हैं नॉर्मल वेट, देन इज ओवर वेट, एंड देन इज ओबेसिटी. तो इन आवर कंट्री नाउ मोर एंड मोर पीपल आर आल्सो पुटिंग ऑन लॉट्स ऑफ वेट. पहला इतना ओबेसिटी कॉमन नहीं था, वो एकदम वेस्टर्न कंट्रीज में हम देखते थे. अभी हम इंडिया में भी ओबेसिटी ज्यादा देखते हैं. ओके, नेक्स्ट प्लीज. 37% of people are either overweight or obese even in our country. Next. Sedentary lifestyle का मतलब नॉट डूइंग रेगुलर एक्सरसाइज. रेगुलर एक्सरसाइज का मतलब कम से कम हफ्ते में 3 बार 30 मिनट का वॉक, उसको हम बोलते हैं रेगुलर. उससे आप कम करते हैं, दैट इज नॉट कॉल्ड रेगुलर. उससे ज्यादा करते हैं, वेरी गुड. नेक्स्ट. ये लास्ट रिस्क फैक्टर है जो हम कहते हैं स्ट्रेस. नाउ स्ट्रेस ऐसी चीज है जो हम मेजर नहीं कर सकते हैं. आई कैन टेल यू व्हाट योर ब्लड प्रेशर इज, आई कैन गिव यू अ नंबर, 120 है, 80 है, शुगर 110 है, 130 है, कोलेस्ट्रॉल 200 है, बट वी कैन नॉट मेजर स्ट्रेस, राइट? हम सब बड़ी शहरों में रहते हैं. स्ट्रेस इज पार्ट ऑफ लाइफ. ओके, ट्रैफिक है, पॉलिटिशियंस है, सब चीज है विच गिव अस स्ट्रेस इन लाइफ. So stress is part and parcel of our life, but how we handle the stress is important. If your stress is affecting you, because of stress you are getting anxious, because of stress you are not sleeping at night, then it becomes a problem. Okay, so these are your risk factors. I will tell you again. What we cannot change: age and family history. Two things. What we can change: smoking, cholesterol, blood pressure, sugar, weight, lack of exercise, and stress. Okay, so 7 things we can change and 2 we cannot change. The more risk factors you have, the higher is your risk. Think of driving. If you're driving a car and you're speeding, it is a risk for an accident. If you're talking on the phone when you're driving, it is a risk for an accident. If your brakes are not working properly, it is a risk for an accident. If it's raining very heavily and the roads are wet and you cannot see properly, it's an accident, risk for accident, right? So these are all risk factors. Jitne zyada risk factors hote hain, itna zyada chances of having an accident. Same way, jitne zyada risk factors hote hain, utne zyada chances of having heart disease. Okay, so we must keep them under strict control if you want to prevent heart disease risk. Next, please. So know your numbers. Take a moment to just look at this slide. If you want up with your cameras, take a picture also. I'll let it be on for 30 seconds. Okay, next please. Now, I'll talk a little bit about some tests. In senior citizens, many of you may have had a test, angiography किया होगा, plastic किया होगा, या आपके family में किसी का हुआ होगा. So, what we do is an angiography, we pass a catheter and we put dye and we see images to see how it looks like. Okay, so this is the normal angiogram. You can see that the dye is moving very clearly. Next, please. ये एंजियोग्राम में यू कैन सी देयर इज अ ब्लॉकेज. आप देख सकते हैं बीच में जहां वो एक स्ट्रॉ जैसा दिखता है ना, और बीच में आप देख सकते हैं कि एकदम टाइट हो गया है. उसका मतलब वो एरिया से खून ठीक से नहीं जा रहा है. तो दैट इज हाउ अ ब्लॉकेज लुक्स. ओके, तो जब ब्लॉकेज होते हैं उसके बाद 3 ऑप्शंस होते हैं. कभी कभी हम कहते हैं कि वी विल डू ओनली मेडिकल मैनेजमेंट, मतलब दवाई और लाइफस्टाइल. समटाइम्स वील से हम दवाई और लाइफस्टाइल करेंगे और उसके उसके ऊपर एक एंजियोप्लास्टी करेंगे, या समटाइम्स वी से दवाई करेंगे, लाइफस्टाइल करेंगे और उसके ऊपर बाईपास करेंगे अगर जरूरत हो तो. ओके, नेक्स्ट प्लीज. So this is again picture of angiography. Next please. बाईपास में क्या करते हैं हम, अलग जगह से एक आर्टरी, एक नली लाकर ब्लॉकेज को बाईपास करते हैं. तो ये ऊपर का नली जो लिखा है इंटरनल मेमोरी आर्टरी ग्राफ, वो आपके आपके नली को जुड़ जाते हैं और वो ब्लॉकेज बाईपास होता है. जैसे रास्ते में एक ट्रैफिक एक्सीडेंट हुआ, we bypass it, right? We take the car from a different road and we bypass the accident. Same way you bypass the blockage. The doctor or the surgeon doesn't take out the blockage, they bypass it. Next, please. This is how angioplasty looks like. You can see the blockage. They are putting a catheter and they put a balloon and they open it up. Okay, see it again. Blockage, catheter, balloon, opening up. Okay, next, please. So before there is that blockage, afterwards they put a stent. Stent is like a small metal piece, like a ballpoint pen ka wo spring na. In the previous years, ballpoint pen mein spring hota tha. It looks exactly like that. That's how a stent looks. Next. So if after heart disease, it is important to make sure we do the right lifestyle changes. Usme exercise is very important. जो हम कहते हैं aerobic exercise, walking, running, cycling, swimming. These are all examples. ये सब हमारे हार्ट पेशेंट से वो एक्सरसाइजिंग. नेक्स्ट. लिटिल बिट ऑफ स्ट्रेंथ ट्रेनिंग, आपका बॉडी को स्ट्रांग रखना, दैट इज ऑल्सो इम्पॉर्टेंट. इट इज रॉन्ग, गलत फहमी है कि if somebody is old you should not do strength training. In fact, if you're older, more reason, because as you grow older, especially for ladies, your muscle mass becomes less, and when your muscle mass becomes less, daily life becomes difficult. If you go shopping and you buy a 5-10 किलो का ग्रोसरी लिया, you have to carry it back ना, फिर घर में ऊपर किचन में ऊपर डालना है, शेल्फ में डालना है. You need muscle to do all that. आप आउट ऑफ टाउन गए वीकेंड पे, कम से कम 5-7 किलो का तो बैग आप आउट ऑफ टाउन के लिए लेंगे. सो यू नीड स्ट्रेंथ टू डू डेली लिविंग. दैट्स वाई डूइंग सम स्ट्रेंथ एक्सरसाइजेज वेट्स के साथ या रबर बैंड के साथ या डम्बेल के साथ, इट इज वेरी इंपॉर्टेंट. नेक्स्ट प्लीज. तो ये हमारे हॉस्पिटल में वी डू व्हाट्स कॉल्ड कार्डियक रिहैब, जहाँ हम पेशेंट का ईसीजी मॉनिटर करते हैं और उनको एक्सरसाइज कराते हैं. दिस जस्ट ये जो मेरे हाथ में, आई एम सिटिंग हियर एंड आई एम मॉनिटरिंग देम ऑन द स्क्रीन लाइक दैट. ओके, नेक्स्ट प्लीज. डाइट में तो हम पूरा एक लेक्चर रख सकते हैं, बट टू पुट इट इन वेरी सिंपल, अगर आई वांट टू पुट इट इन टू लाइन नटशेल, ऐसा नहीं है कि बिल्कुल कोई डाइट का वस्तु नहीं है जो आप बिल्कुल खा नहीं सकते. इन अदर वर्ड्स, आई डोंट से कि एनीथिंग, देयर इज नो पॉइजन फूड एंड देयर इज नो मैजिक फूड. एवरीथिंग इज फाइन इन क्वांटिटी. For your weight, quantity is also very important. They have found research that people who eat little bit less, especially in older ages after 65, 70, they tend to live the longest and healthiest. Okay. So quantity is also important. Eat from all food groups. Maximum, you should try and eat more fruits and vegetables as part of your diet. Okay. In India, even vegetarian diet में we say vegetarian diet, but vegetables ही नहीं है, सिर्फ राइस दाल होता है, राइस दाल चपाती. Vegetables are important, fruits are important, grains are important. If you eat non-vegetarian food, little chicken, little egg, little fish, nothing wrong in that. But that should not be the major part of your diet. The major part should be your vegetables and a small amount of the meat part if you're eating that. Next, please. Now, to get active, to make lifestyle changes, everybody makes excuses, right? क्या common excuse है? Time नहीं है, ये नहीं है. Next, I'm going to show you 3-4 pictures of people who have all the excuse, but they still go ahead. This gentleman is an army major. Kargil war में बेचारा he lost his leg. You can see in this picture जहाँ red line है, it is a artificial leg. तो भी वो marathon भागता है with artificial leg. In your right side पे all these pictures, people have one or two artificial legs and they also run marathon. They've been inspired by Major Singh. Next, please. ये मेरे पेशेंट्स है जिसके हार्ट डिजीज हुए. जब मैंने आई वाज इन एशियन आर्ट, एवरी ईयर वी यूज्ड टू हैव 100 of our patients take part in marathon after bypass surgery, after angioplasty. So this is just one of the year's picture of them. And this is a picture of my book. It's called The Heart Truth. It's available on Amazon. So everything that I've spoken, including some recipes and all those things, they're all there part of this. So next, please. That was my last slide. So we can open it up to Q&A. So if you put up your questions in the chat box, I will read them and I'll be more than happy to answer them. Thank you. So we'll give, okay, already somebody had put a question. Has BP parameters changed and has blood sugar parameters changed? So BP 120, 80 or less being normal is been there for a long, long time. That has not changed. Definition of hypertension is constantly dropping. For years, it used to be 140, 90. Now, some societies are even calling over 130 as hypertension and over 85 as hypertension. 50 years back, we used to say BP, normal BP is 100 plus your age. That is wrong. And many people say, अभी मेरे age के लिए normal है. नहीं, age के लिए normal है. अगर 150, 160 होगा, तो then even stroke is normal. Do we want to accept stroke or heart disease? No. So we want to keep BP under good control. Sugar parameters also not changed for a long time. 70 to 100 fasting. Earlier it used to be 70 to 110, but now since many, many years it is 70 to 100. 100 to 125 is called borderline. This is fasting, not after food, fasting. And after more than 125 is diabetic. Okay, how much fat and what type? So fat should form roughly, I'm giving you andaste, about 1/3 of your diet from a calorie point of view. And what type unsaturated fat is good? For example, the kind you get in, say, an olive oil type of thing. Fat you also get in avocado, fat you get in peanuts, many, many sources of it. Fat's also there in chicken or fish, but not that much, and it's under control. So, fat typically should be about 25 to 30% of your diet. Intermittent fasting for diabetics, it's not a bad thing to do. However, it has to be monitored. See, many people, supposing you are fasting for, you know, common thing they say is that we'll 16 hours fasting and 8 hours eating. Uska matlab kya? That say from 12 o'clock in the afternoon to 8 o'clock at night, within that window you eat, and after 8 o'clock at night you don't eat anything till 12 in the afternoon. Some people go even more drastic. They will not eat for 18 hours. They will not eat for 20 hours. Some are doing 22 hours. Those things should not be done without any medical supervision. If you're doing intermittent fasting and it's helping you, but speak to your doctor. If you've got diabetes, speak to diabetologist. It can help in a when done correctly, but at the same time, I don't think you have to do it. It has become a fad of late that that you got to that you must do intermittent fasting. ऐसा नहीं है कि you must do. Okay. What tests should be done to check heart strength and what frequency? See, this is a difficult question to answer because heart ke liye there is no one test. I would put a very simple rule of thumb. Everybody, every adult must know what their blood pressure is, must know what their sugar is, must know what their cholesterol is, must know what their weight is. That is very easy to do. Okay, it costs you nothing. Sugar and cholesterol ka to within less than 1,000 rupees you can do. BP you will do for free. Weight you do for free. उसके अलावा you can do a ECG, 2D echo. If required, you can meet your doctor and decide whether to do a stress test. उसके बाद any further testing will depend on the results of these basic tests. I don't think everybody has to go and do CT angio and things like that. And especially after 60, 70, everybody doesn't also have to go and do things like stress tests. It is very individual. But basic sugar, cholesterol, BP, of course, every adult needs to do on a regular basis. That's very simple. Once you start BP medicine, do you have to continue lifelong? Yes, it's a common question. The answer is no. You don't have to continue lifetime. What do we want? We want control. Now, supposing your BP is 150 or 140 and you are very overweight, you're not taking care of lifestyle. अगर आप medicine शुरू किए and at the same time you improved your lifestyle, it is possible that the BP may come under control without medicine. Or it's possible that after improving lifestyle, instead of 3 medicine you are under control with 2 medicine. So we want control. If over time you are able to control it without medicine, by all means the medicine can stop. Normal range of HbA1c. HbA1c is an average of 3 months ka blood sugar. Normal value should be 5.7 or less. 5.7 to 6.5 we call borderline, and more than 6.5 we call diabetes. I love this test more than fasting sugar for your diabetes. Insulin resistance and all the little more complicated tests, I would say just do HbA1c, that is fine. After medication, 140, 90 is your blood pressure safe? So ideally, I'd like it to be lower, but person to person, sometimes people take more and it drops a lot. So that has to be taken, watched on a case to case basis. But at least 140, 90 tak to lao. Less than that, typically would be better, but talk to the doctor. How to control cholesterol? Cholesterol has got a genetic component, food component, exercise. Genetic, you can't do anything about. Food component, I gave you some basic tips. And exercise at least 5 to 6 days a week, 30 to 40-minute walk is good enough. I'm 78, my heart right side of the bundle is blocked. Doc says, okay, yes, it's fine. What they call right bundle branch block is a fairly uh, safe thing. It's nothing wrong with it. High salt and high BP, there are no reports that high salt is good for reducing BP. That is absolutely wrong. There are some reports that in some people, even if they take high salt, BP doesn't matter because some people are called salt sensitive, salt resistance. As of now, the thinking is still that we must keep salt under control, which is 1 teaspoon per person per day of salt throughout the day, cooking and everything. Okay. Um, How often blood tests to be done if everything is normal? Good question. If you've done it 2, 3 times consecutively and it's normal, then once in 2 years should also be fine. Recommended instrument. Today, many instruments are there. One company which has been around for a long time is Omron. And within that also, I think they have a high, lot of ranges. Take the instrument which puts a cuff around your arm, not around your wrist. And, take the mid end, ekdam low end wala mat lo. The chemists today also have it. You just asked wrist BP cuff. No, I'm not so happy with the wrist. I would prefer a arm one. Though again, as technology is improving, even with the newer wristbands, they're probably as accurate, but I'm just more comfortable with the arm one. Okay, I'm very happy. Everybody's been very interactive, and hopefully I've been able to keep up with the pace of your questions. Hmm. Low vitamin D cause heart problem? Very, very good question. People are researching and looking more and more at vitamin D. There isn't a direct connection for sure. People are looking at many different indirect connection types of things. But if your vitamin D is low, correct it. It's quite easy. It can be corrected. So, but as of now, it's certainly not a major risk factor for heart disease the way cholesterol or blood pressure is. Caffeine bad? No. Now what happens is some people, when they have a lot of caffeine, they may get irregular heartbeat. Now, unfortunately, if you are one of those people, then for you, you need to reduce the caffeine. In general, both caffeine, coffee, tea, in normal quantities, what people take somewhere between 1 to 3 cups a day is fine. Fasting sugars coming high depends how high, right? If it's just 1.5, 110, 115, it would be fine. But if it's routinely 130, 140, 150, then it may be time to consider some medicine. How often should I do CT scan? No, CT scan should not be done routinely. CT scan gives you a lot of radiation, and CT scan must be done only under the guidance of your cardiologist. I'm assuming you're meeting a cardiac CT. Should not do it routinely at all. Do we have to continue with diabetes medicine even if the this? Now it's possible that it's below A1C, below 5.7 because of medicine. But without medicine, if you're able to control it, great. That's fine. Family history of heart attack in my brother before his 50th birthday. I was started on low dose atorvastatin. With statin, there is muscular pain. See, honestly, 99% of people that I have seen on statin are completely fine. And sometimes they get little aches and pains, they get used to it. Now, if you are a person specifically कि आपका life affect हो रहा है, you're not able to do daily activities because of statin pain, then talk to the doctor to look for other types of drugs. Otherwise, a statin is a good drug, very helpful drug. When on BP, how frequently should it be measured? I would say it all depends. If once your numbers are under control, once in a week, once in 2 weeks is fine. If it's under control routinely, then once in 2, 3 months is also fine. But if it's not under control and keeps fluctuating, then maybe you can even check it every day. Basic
What to do?
precaution. Basic
What to
precaution.
do?
Put your question in the chat box, madam. That'll be easier. Basic precaution for first aid. See, there's not too much first aid that one can do. But if you're feeling you're getting a heart attack, एक aspirin लेकर खा जाओ. That is the best thing. Call the hospital and go straight to the hospital. Don't wait for family doctor and all that to come. People waste time. Alone and suffers a heart attack, call ambulance and head to hospital straight away. Does statin induce muscle loss? No. Is it good tablet to take tablet to control cholesterol? Yes, statins are overall very good if you need them.
How to control high BP?
High BP, lose weight if you are overweight, modify your diet if it can be modified, and third is medicine. For a lot of people over the age of 70, 75, it is inevitable that even with great lifestyle, the BP will be little high and you'll need medicine. So don't. A lot of our Indian people have a mindset ke block ke nahi dawa nahi lena chahiye. Don't do that. If dawa is giving you a better life, take it. It's as simple as that.
I am 94 years old.
God bless you, madam. God bless.
Uh, so
Fantastic.
I'm taking um, set, Setanil.
Okay.
It's okay
For I what is Setanil for? I don't know. It's a company ka naam. I'm
for
not
high
familiar.
BP.
That if
Okay,
whatever
okay,
medicine you're taking for high
okay.
BP, as long as it's got good control, it's fine. Any particular time to measure BP in the day? No, measure it at different times. CT angio compared to angio, they are quite close to each other. But if your CT angio mein takleef nikla, then you have to do regular angio. Sciatic nerve pain connected with heart problem? No. Okay. Calcium count is high. If see, calcium in your arteries is different from calcium in your food. Calcium in the artery and food have got no connection to each other. So if your heart CT angio ka calcium score is high, you have to take all the precautions I spoke to you about. Nothing to do specifically with calcium in food. Mein wo connection nahi hai. Best time to take BP, random different times of day because we want it under control all the time. So there is no one best time. Triglycerides also contribute, but they're not as bad as LDL and total cholesterol, but definitely keep them below 150. Heart enlargement, depending on what it is, it may be a cardiomyopathy. You talk to your doctor. You may have to keep, you may, I'm not saying necessary, have to keep your fluid under check. Can one take melatonin if having sleep problems? Yes. Senior, is dairy good? There's nothing like good and bad. Dairy is part of your diet. So taken in normal quantities, have a little curd, have a little paneer, have a little chas, absolutely fine. If it affects your stomach specifically, then keep it under control. Many people are intolerant of milk products. So keep it under control if it bothers you specifically. Otherwise, by itself, it's fine. How much melatonin? I don't know the doses, but typically I think people take up to about 6 milligrams or even higher. But I'm not familiar with the melatonin doses. Sometimes fasting is more than the postprandial. Yes, it happens to me also because our body, the liver is producing sugar at night. Not much you can do about it. Ghee to be avoided for high cholesterol. I won't say avoid, but keep in limited quantity. Up to about 1 teaspoon a day should be fine. Cheese can be had for heart patients, yes. But again, everything in common sense. There's no poison food. If I say you can have cheese, does not mean कि आप रोज आधा किलो खाओ, right? You take one piece with your breakfast every morning, should be fine. High acidity thought heart attack, very true. So many people acidity का symptoms or heart का symptoms same होता है. When in doubt, get it checked. Why do diabetes have silent heart attacks? Because often their nerves and all are affected, so their sensations are less. Okay.
Any more questions, anyone? Yeah, there's
Okay.
one.
Can we have a last couple of questions? I also actually there's a couple of
Yes.
patients waiting for me. I need to go.
Yes, doctor. So in the meantime, Abhijit has put a form on the chat. Please fill that form out, all of you. He's put a link over there.
Oil intake 1 teaspoon per day, nahi. 1 tablespoon per day is fine. Sugar is different. Sugar, maybe you keep it under control. Sugar ka, there is no specific added sugar ka limit, but overall, the less sugar you consume, added sugar, the better for you. Because sugar comes in all our food also. I have hyponatremia, means low salt. I also have a stent, hypertension, and uh, diabetes. I'm taking more salty food. What should I do to make my sodium rise? Now, this is a very individual question. Sodium, potassium need to be controlled very tightly in the blood. So it's not fair for me to give a generic answer without knowing the full history, full values. So those kind of things you must chat with your doctor. Okay. Avoid it for LDL, like this, the things we spoke about. You got to take care of your diet, avoid excessive saturated fat, avoid a lot of whole milk, avoid excessive eggs and things like that. In normal quantity, it's fine.
Yeah, we'll just take one more question, doctor.
High fiber diet is fine. Yes, good.
Yeah. Okay. So kindly, all of you, just go on the link and fill out the form which Abhijit has put. Abhijit just post it once again, so everybody will, yeah, click the form and fill it out, please. Thank you. And yeah, doctor, I guess you need to leave now.
Yes. So last question. Somebody asked 1 egg per day is fine. No problem. Okay.
Yeah. Okay. Thank you so much, doctor. Really appreciate you taking the
Thank
time.
you. Take care of yourselves. Good health,
Understand.
Thank
everybody.
you,
Thank you,
doctor.
everybody. Yeah. Uh, so yeah, thank you all of you who attended the class today. Anurag, you can probably spotlight me.
Yes, ma'am. Done, ma'am.
Yeah. So thank you all of you who attended the class today, and I'm sure it helped you all a lot to gain a little bit more knowledge about this very common problem that most of our folks face. And like he said, especially in India. So I hope you've taken down the details, and thank you all for attending. In case you'd like to have sessions like this, and do let us know. And other than this also, if there's something in particular you would like to have, any kind of session that you would like to have, or if you are talented and if you have something that you would like to share with all our members, please do get in touch with me. I'll be more than happy to host you all where you can share your talent, and let it be any kind of talent. If you are good at craft or singing or just presenting something, or just let it be anything at all, do get in touch with me, because this is the platform where you can actually show off your talent, because if you don't do it now, when will you do it? So go ahead and make the best of it, because this is one place where we welcome people with talent, or yeah, thank you, Anita. People with talent, and we encourage you to make the best of it. And not only that, you're also sharing it with others as well. So we have many of our ambassadors like Anita, I'm sorry, Archana, who's here, Sunita Mehta, and a lot of others, Bharti, who come and share their cooking talents, their craft making, and so many other things, which is so loved by all our members. So you can let me know what kind of sessions you would like, and if you have anything that you would like to share with our members, please do let us know. And also we have a lot of very interesting stuff coming up, so you please keep tuned in to get set up. Invite all your friends, and especially people who are our age, who you think will thank you, Mehboob, who you think will benefit from this. Please spread the word, because it's we are all at the same age, we all have the same problem, so why not everybody make the best of it? I mean, it is helpful for everyone. So I think it's but fair that we share our what we are getting for free. Why don't we share it with everybody else as well? So please send out the links to all your friends who are in the same age group, and I'm sure everybody will benefit from it, and you will be blessed as well at the same time. So yes, thank you very much. And thank you all for being here and encouraging us to do this for you all. We love doing it. We love, getting you new
Thank
stuff
you.
every
Thank
time.
you.
Thank
And
you.
Thank you, Anika ji. Thank you.
Thank you. And it's so encouraging for us when we see so many people coming to attend. It definitely encourages us as well. So I hope you all
Thank you
continue.
so much, ma'am.
You're more than welcome. You're happy to be here, and give you all the best as well. Thank you so much, everyone.
Anita ji, is it possible to give a talk on MND disease, motor neuron disease?
M and E.
MND,
M and D. Okay, we
motor
will.
neuron disease.
Yeah. We will try, because getting specialists like Dr. Aashish Contractor, who was here today,
Yeah.
very difficult. Okay, because they cannot spare so much of time to come and give a talk. They are like super busy. But yes, if we can find somebody to come and give a talk, definitely we will. Definitely.
Because I'm keen. I lost my son due to that. I want to know why the reason like that. I'm
Oh.
curious to know.
Okay.
Okay.
Definitely.
Thank you very much.
Definitely try. Thank you.
Ma'am, I'm very fond of writing. So
Oh.
what I'm supposed to do?
We have a writers group. Is that who is speaking? Is that Sona?
This is Miss Subramaniam. Pushpa.
Okay. We have a writers group. Put it on your number on the chat, and Abhijit will add you to the writers group. Abhijit, you're there now?
Yeah,
Abhijit?
I'm there. I'll send a link.
Yeah, she
Okay,
will
okay.
add you to the writers group and you can share
Ah,
because we have a lot of writers on the platform as well.
okay, okay.
You can
So
share
I'll
the.
share here with my number.
Yeah. Just put it on the chat.
Okay.
Yeah.
Would this be available on record? Recording will be available for today's
On the
session.
app, please download the app and yes, you will get the recording. By tomorrow, it should be there. So download the app for that. We have all the recordings on the
How
app.
long
Thank you.
Please
Thank
fill
you.
out the
usually?
form.
Minnie, you have raised your hand. Minnie, is there something you want to share? Minnie? Okay, I
How
guess.
long it will be there in the app?
How long?
It will be there in the app.
It'll be there for some time. Don't worry. I mean, you can go and check it out tomorrow and yeah, you can watch it all over again in case if you want. Thank you. Thank you, everyone.
Anita, I raised my hand. I wanted to ask a question to the doctor, but he is left now.
Yeah.
Uh,
Save it maybe for that when we have a next heart health session. You can always ask them. You should have just put it on the chat now, Minnie. I mean,
no, I had put one question, but there was particularly another question. Like I had put one question about triglycerides. How do they affect? He said to some extent, but
okay.
cholesterol is more a culprit. But when I looked into the reports of my mother, she had normal cholesterol, but triglycerides were high. But she had a severe heart attack. So why did that happen? So I just wanted to discuss. I mean, that question I could not. It was difficult to type such a big question.
Yeah, right. So, but anyway, like I said, specialists like him are very difficult to get with really lot of influence. And this thing, we got him on the platform today. So I'm glad all of you benefited by it. But yeah, so it's okay. Next time we will try and ask if we can find another heart specialist to come and take one more session for us. So you keep your questions ready and we can definitely take it up in the next time. Abhijit, just take Pushpa Subramaniam's number and add her to the writers group, please. Yeah. So thank you very much, everyone. Lovely meeting you all and hope to see you all in the next session. There are lots coming up. Check out
Thank
the
you.
app,
Thank
download
you.
it. And more than anything else, pass it on to your friends, family members who are above 50, anyone who you think will benefit by it, because sessions like this are very rare and we try to have it as much as possible. Join in the marathon. We have the entire week for heart health. So join in for join
Anita,
in. Yes.
Anita, can people of 50 years old, people who are 50 years old, can they register in this app?
Of course. Yes.
I thought it was 55.
It is 55, but it's okay if they're 50, no problem. They can register. Of course they can. Yeah. Okay, I think there is too much of disturbance. Somebody is like talking. I'm muting them. Yes, is there anything else or shall we close the session? Anybody wants to ask something or say something, more than welcome. We are here to chat with you all. Okay, then. So thank you very much and see you all in the next session. Follow the health sessions that are going on. Join and keep healthy.
Anita, can I make one request? I mean, it's a different topic altogether.
Yeah.
But since I've got an opportunity to talk to you, we had very good lessons by Mr. Ajay Chandiramani on finance.
Correct.
So, I mean, they are not being held now, for quite some time. So,
Correct. Yeah. The thing is, because we can't hold sessions unless we can hold a session only if there are 20 people. So if 5 people, 2 people, 3 people, it's not feasible to hold it. So what happened with the Ajay's thing is like you might be interested and maybe 2 more people and the rest, like, nobody attends financial session, unfortunately. So that's the reason we had to stop it. Yeah.
but they were very useful, very useful.
I know. We had a lot of tech sessions also, which were extremely useful. But unfortunately, there are very few takers for it. So we can't hold sessions for 2 people attendance.
He's very good, Anita. I mean, I think
Yes.
you should call
Get
him.
people, get us 20 people and we'll keep the session. No problem at all. Absolutely. 20 people attending, no problem. Even like 17, 18 people, also it's fine. But we really can't keep sessions for 2 people, right? I mean, that's a little not possible at all. So that's the only reason. Tech sessions, you want, get 20 people and we'll have tech sessions as well. We have so many fantastic tech technology teachers who teach basics, who've taught many of the members. So yeah, so we need attendance. Without attendance, how is it? How can we have a session without attendance? That's the uh, that's the
Sad, very sad.
yeah, it
Maybe
is
once a
more
month.
than you, more
Maybe
than you. We feel more sad actually.
maybe
Yeah.
once a month, like we were having weekly sessions of Mr. Rajay. So even if we have it once a month, I think we can have more attendance that way.
Yeah, so you keep watching the calendar and keep watching the calendar and attend the sessions that you guys like to attend. So if we have more attendance, the more we can give. So please, that's why I said send it to all your friends, invite people. So it's not just for for few people who attend all the time. It's for everybody. Let everybody make use of it. So spread the word, get more people in. That way you benefit, they benefit, or everybody benefits. So we would also like to have more sessions, like yes, Raju's session, Ajay's session, or Aruna's session. We have lots of wonderful teachers on the platform, and we would love for them to come and teach you guys. But the point is, like, if you can get your friends to attend, or somebody in your family or anyone to attend, yeah, we more than happy to give the sessions. The thing is that the topic should be of interest, right? So you suggest what topic you want, and we'll make sure that if you can get some new people in, we can also start again. No problem. Yeah. So I think one way is to spread the word, so that everybody is benefits from all this, and we get more members in the session. So that way it's nice. I mean, I'm sure you feel good if a friend of yours is benefited, or if some family member is also benefited by it. So just go ahead and tell them to. All they have to do is download the app. We have so many different sessions. We work so hard behind the screens to get it to you all. So make the best of it, when you can. Why not? You and also others as well. So please do send out the link for the app to as many people as possible. And you're most welcome to ask us for more sessions and what kind of sessions you want. You're most welcome to come and take sessions with us. We would love to have you do that because it gives us, nice to have you teach, and it's nice to have you share your talent as well to all our members. Yes. Anything else that I can help you with?
Thank you. It was a really good session.
Absolutely. I thought so too. It's absolutely really, really very nice.
Very nice.
So, like I said, I hope you guys will just pass on the app link to everybody. Abhijit, can you put the app link on the chat?
I'll do.
Okay. So, yeah, so he's put the app link. Copy it, send it to on your WhatsApp groups actually, and tell them it's for people above 50, and let them download it and yeah, enjoy and benefit from all the different kind of sessions that we have. Okay, thank you. Thank you very much. Thank you all of
so
you who
much.
have attended. Thank you so much. Yeah. Hope to see you all in the next session.
Thank
Bye.
you.
Have a
Bye.
good night. Bye-bye.